We're gonna go take an x-ray, but let me show you your teeth first, okay? Happy?
Thank you, doctor.
It's my pleasure. Let's take a little bit of pressure. It's a little triangle here, but I tried to close it as much as I can. How old feeling? You see the tooth in the back on the right also, it's broken. You got a little... All right, let's do it again. Bye. I still owe you one veneer. We're gonna change it next week. All right, it's the beginning of the week. We're gonna change a lot of lives. Let's go, come see. Hi, how are you? Excited for today? Oh my goodness. Finally here. Yeah, no, you're keeping it very clean. You're doing a great job. Open. I know. Just going in, okay? Get any food stuck. That's it. Almost done. Retractor, black background. We're gonna go take an x-ray, but let me show you your teeth first, okay? Come. Look here. Look how nice the gum is. All the holes are gonna close. We're just gonna take x-ray and then we close all the holes, okay? It's gonna be all white everywhere. Happy?
Amazing, yeah. Thank you, doctor.
My pleasure. Let's take an x-ray so we can make sure everything is perfect, okay? Okay. So that first patient is done. She had like severe gum disease. I saw her about 2 years ago for a consultation. And, you know, sometimes people wait, and she waited and her infection got even more so to the point where her whole lower jaw in the front was eaten away by her infection. We had to rebuild everything the time of surgery. 3 weeks later, she has her permanent teeth with, I think, seven implants. And you can see how happy she is. So this is what it's all about. Yeah. Okay, for their cleaning, you mean? Yeah, okay. We're going to schedule it now so they come together. All right, let me numb you up. Okay, open wide. We'll do the top first. Deep breath. Relax, put your head back. 2, 3. Lots of water. Ready to see yourself? All right. What's up? Sit up. Watch your head. That's all you. I still owe you one veneer. We're going to change it next week.
That's so good. You said they do better and here better.
Yeah.
Wow.
They have, like, you know, little imperfections to make them real. That's the beauty of your veneers. Like, every veneer has a different style. Yours has these little imperfections that you may not see that allows it to just be real. Whether it's a little ridge, whether it's a little color, just these little, whether it's a little height, a little curve, all that fun stuff.
I got a million in here.
Crazy, right?
My lip goes back to normal.
And then your gums are also going to get better now because now the teeth are no longer connected. It's only going to get better every day. your back molar, which is one I didn't work on, is like rotated a bit, so I just want to get the right path. That's to get the under part that you got food stuck there. I tried to tighten it up as best as I can. Yeah, and just I changed a lot of the contours just to try and make it a little bit better. I felt like the original one was maybe a little bit too thick on some areas, so I brought it in so you'll feel, you may or may not feel it, but when you eat, you won't feel like the tooth is bulging out as much. Your teeth here, see how this one is like angled, like that, as opposed to being like this. This tooth here, yeah. Same thing here, this one is angled, so sort of like the tooth is sort of like that, so yeah. So, make sure, okay, let's take the x-ray and I'll be back, okay? Let me see, let me check. I mean, I can, if you could just look here, just so I can show you what you see, okay? Just so you could understand. If you look at here, this and this is your new crowns, okay? You see all of this and this and this. This is like all old filling. All old filling. You see the tooth in the back on the right also, it's broken. You have a little bit of a cavity here. So what happens is I would tell you this, they're probably 30 plus years old, like easily. So what happens is not that you're not doing your job. It's like, I wouldn't say it's like tires, because tires, they don't even last me a year, but you know, the material sort of wears down after a while and starts to crack. So I will tell you, like in your near future, in the next, like I would say 1 to 5 years, you're gonna be fixing these things as they sort of break. So it's not like, oh, one on one side, one is worse than the other. Like even the crown next to this one, I changed this one. These two were done at the exact same time when you had it done.
As far as you can see, you don't see any cavities, right?
No, well, let me show you. I'm going to show you a picture of it so you don't even need to be a dentist, you can look. The tooth that we fixed on the bottom was this one right here. So it's not so much the tooth, it's more the gum from the injection and from the cutting of the laser. But it will heal. Okay, good to see you. So even in an implantologist's day, you get to see, you know, simple, maybe complicated things. Patient we just finished, you know, it's very interesting if patients get to a point in their lives where they haven't had dentistry for a really long time. Not because they're neglectful, but because they had restorative dentistry 20, 30, 40 years ago, and all these amalgams now start to break. And they don't realize that, you know, out of, let's say, the 28 teeth in their mouth, 20 of them have been restored 30 years ago. And now they need to be fixed. And it's sort of like a hard conversation to explain to them that for so many years they haven't had dentistry done. And now all of a sudden they need constant dentistry, a crown, because those large amalgams that were done 34 years ago are just not going to cut it anymore because there's not much of the tooth left. My other patient, we did a full mouth rehab, and sometimes we find, like around single implants, the natural adjacent teeth move. And whether they're moving up, moving down, moving right, moving back, we start to see in the future some sort of like open contact, and people have problems sort of cleaning that area, and we don't want them to lose their natural teeth. So like everything else, patients come, they have their teeth cleaned, they take care of their teeth, it's not their fault that they move. We just redesign the crown, mill it, next day we give it to them, and they are on their way. All right, let's continue on. A little bit of everything. Sometimes even preventing big dentistry from happening. So we just did quick little 2 fillings on top surface of the tooth with the laser, no anesthesia, done in under 5 minutes. That's easy dentistry, and sometimes it's a breath of fresh air to do something that's not so complicated, but we continue. Okay, see you soon. Have a safe trip, okay?
like faint, not like nothing.